Rahim. Today we will have case quiz number 24. Case data: 53 years old female. The patient developed severe back pain while shopping. She lifted heavy bags into her car and experienced worsening back pain as she drove home. It was difficult for her to find a comfortable position. Later in the day, she noticed that the pain was now radiating down to back of both legs. She had no sensation in her buttocks. She had episodes of urinary incontinence, so sensory, motor, and sphincter. So, what is the diagnosis? The answer is I think the case is yes, it is easy. It is direct, straightforward. Coda equina syndrome. Coda equina syndrome. Coda equina syndrome. The diagnosis is Coda equina syndrome and is an orthopedic emergency. The condition is characterized by red flag signs comprising low back pain, unilateral or bilateral sciatica, sudden anesthesia with sacral sparing, and bladder and bowel dysfunctions. Urinary retention is the most consistent finding. Initially, the patient may report difficulty starting or stopping a stream of urine, and this may be followed by frank incontinence, first for urine and then for stool. Rectal examination often reveals poor anal tone. The urinary incontinence is secondary to overflow. There may be a variable lower extremity motor and sensory loss depending on the affected nerve roots. The reflexes may be present, but they are typically reduced or absent. The coda equina is below the level of the conus medullaris. Here the spinal canal is filled with the coda equina, which consists of motor and sensory nerve roots. Lesions can complete the coda equina nerve roots. Examples are large central disc prolapse, primary or secondary metastatic disease to the spine, epidural abscess or hematoma, and trauma. It may also be the result of surgical morbidity. MRI is the investigation of choice for these cases. The scan also assists in the diagnosis of the primary problem. Urgent spinal orthopedic or neurosurgical consultation is essential, with transfer to a unit capable of undertaking any definitive surgery considered necessary. In the long term, residual weakness, incontinence, impotence, and/or sensory abnormalities are potential problems if therapy is delayed. The early use of steroids is widely debated. The prognosis improves if a definitive cause is identified and appropriate surgical spinal decompression occurs early. Late surgical decompression produces varying results and is often associated with a poorer outcome. Take a home message. Coda equina syndrome is an orthopedic emergency. Red flag signs are low back pain, unilateral or bilateral sciatica, sudden anesthesia with sacral sparing, and bladder and bowel dysfunction. Urgent spinal orthopedic or neurosurgical consultation is essential. And finally, thank you very much for your attendance, and we will meet you in the next future with case quiz number 25. Wassalamu alaikum wa rahmatullahi wa barakatuh.